The free market at work, and I love it. The medical tourism industry is going domestic as Americans look for more affordable options. They are bypassing their insurance companies. This is fascinating. Dan Springer is live in Seattle with more on this. Tell us how, Dan.
Yeah, hey Melissa, it turns out competition can lower prices even in the field of healthcare. There is a growing medical tourism market, and it's right here in the U.S., driven mainly by self-insured companies that are demanding, and here's the key, getting transparent pricing. Anita Graves is a perfect example of how it works. She needed a total knee replacement surgery. Her employer shopped around and found a way to save big money, and she was open to traveling. So the company flew her first class from Omaha, Nebraska to Longview, Washington, near Portland. It saved $22,000 on the operation and still came out way ahead after paying all of Anita's travel expenses and the $1,500 that would have been her out-of-pocket cost. Pacific Surgical did the operation.
This actually lets the market decide what that procedure is really worth. So it is more nimble, it's more responsive, and it stays responsible to what the real costs to the individual and to society are.
Pacific Surgical started advertising cash prices in 2017. Since then, dozens of patients have flown in from across the U.S. and Canada. Costs are being held down by outpatient centers with far less overhead than hospitals. Since encouraging employees to shop around, the Cowlitz County Public Utility District has seen its medical expenses go flat. If workers save money, they can skip co-pays and get $100 cash back.
It's a power that the average person doesn't know they have, I think, and it feels like you're making a choice in your health care and the cost.
Medical tourism injects free market principles with providers competing across state lines, just the opposite of the Medicare for All, which we're seeing on the campaign trail already for the 2020 election. Melissa?
Great story. Dan Springer, thank you.